Hello and welcome to Simply Technical. I am your host, one of your hosts, Evan, and Keaton's on the end there if you're on YouTube.
What's up?
Check us out. Video feed. Hannah, don't smile so much. This is Hannah. She's the first woman we've ever had on Simply Technical. Before she said she was honored, so
I am very honored.
she's not going to say it on record.
She was my lab partner and carried me in immunology the whole semester.
So
Yeah.
she's really smart. She's almost as smart as me, but she's definitely smarter than Keaton. So,
Yes.
But anyways, first we're going to start off talking about PA school because she is trying to be not a doctor. I always said a doctor. What is it?
Physician assistant.
I almost said physical assistant. That's completely different. Physician's assistant or PA. We'll start off talking about that, and then we got a little debate, and we don't know if it's going to be one episode or two episodes. Might be a part two. Obviously, when you're watching, you'll know. But let's get into it. So, Hannah, what school are you at now?
I'm at Oklahoma City University.
OCU.
OCU. Yep. PA.
PA. And you? What was your undergrad?
I went to Oklahoma Christian. It was biology. Biology. No minor, just major biology, and that was it.
Did you get straight into the PA school after?
I applied when I was in my junior year at OC. When I thought I was like, oh, I'm gonna, I'll graduate earlier, have a semester left, and I applied early, didn't get in the first time, or got waitlisted at OU and then another college.
Yeah.
And so from there, just was like, okay, I'm just gonna, whenever I graduate, I'll take some time off work, and then I applied to 11 schools.
Oh man.
Yeah, it's pretty penny. 11 schools from like Texas, Kansas, Denver, California, and then got a couple interviews, and then got an interview at OCU, which is a whole process within itself.
Because it's OCU, or because they have a longer process, or
Just the whole process of like getting accepted and having all this stuff turned in. You have to get so many letters of recommendation, your whole personal statement.
So it's almost like you're getting a secret clearance or something.
It is. It really is. You literally have to sign your life over, and they have to get all your information. But
On a scale of 1 to 10, how would you rate OCU as a PA school?
so it's newer. So we're
It's
the
newer?
third
Okay.
class there.
Okay.
Oh wow.
So yeah,
So they haven't had a
So they
graduating
are
class then,
just
right?
they
graduating
had.
right
We
now.
just had a graduating
Okay.
class. Well, I guess we've had two. We had two.
Okay.
One that just graduated in May this year, but we had one last year too. And they did good. They had 100% pass rate, but then I think this next year was a little lower. But so we're the only third class. So it's, in comparison, there's still some like kinks and stuff that has to be worked out.
Mm-hmm.
And they're still just trying to get everything, I guess, put in the books.
Figured out, get it stapled,
Yeah.
And I said stapled. I don't know why I said stapled, but
See
ironed
about
out.
the-
Yeah, ironed out is probably the best word. Okay, so
What made you want to do PA
Yeah.
over the other choices?
And that's another question they'll ask you in the interview process, and you have to like give like
Oh,
a
yeah.
statement of like why you chose PA instead of like MD or nurse or all this kind of stuff. Honestly, the amount of schooling MD
Yeah.
is not very attractive for whenever
Yeah.
you want to be like, I want to work, I want to make money. So
PA school is 2 years?
2.5 years,
2.5
yeah.
years? Okay.
Roughly like 28 months, 29 months, depends on your program.
That's like
Okay.
a massive difference from medical school.
Massive,
That's
yeah. So
huge.
that was
money-wise and time-wise? Because, money is,
I mean,
that's the big thing
you
about
come
med
out and
school.
make, almost as much as a doctor will make. It's pretty comparable.
Yeah, in some situations you could make up to how much ever
Yeah.
an MD or DO would make.
Yeah.
The timeline's quicker. You just kind of rush through what, their first 2 years of med students do in a whole year. And so you get that done, and then you're a year and a half, depending on what program you're in, or your clinicals. And money-wise for the programs, it all depends, but, PA is definitely cheaper than MD or
Yeah.
any other route that you want to do instead of like a 4-year school. But OCU is private, so it's
more
expensive.
expensive.
Yeah.
Super
Yeah.
expensive. Honestly, I talked to a med student the other day where she said that the cost for our attendance for PA school was more than her ND.
Oh wow.
Wow.
She must.
So she goes OU. So
She must have been in state. I
She's
mean,
in
it's pretty
state, yeah.
cheap at OU for in states.
yeah. So it's expensive, but it's worth it so far. So
are there any things that you've learned? You said, so you've been in for a year, right? Or
year and a half,
year and a
a
half?
little over
So
a year and a half,
You're about to graduate.
almost time, less than
Okay.
6 months.
Okay,
That's-
so, a year and a half ago when you were telling, Hannah then, what would you change or what would you study more? Study less? I always saw you studying, so.
Hannah studies a ton.
Honestly, I think if I would go back to myself, how I was freaking out, a year and a half ago about how crazy it was, I would have just told myself, like, you can do it. Like, you're going to be fine. It's okay to take days off. Like, it's okay to take nights off. Like, you can put the book down.
Relax.
And
yeah.
have a life. Yeah, I definitely probably would have not studied as much, but also then again, I'm happy and proud of where I'm at.
Yeah, I mean, you've worked really hard.
Do they
We were
have-
watching an OU game with her once, and she was
She was studying in
studying
the
while
middle
we
of
were
the game.
watching the game. We're like,
I remember that.
I was like, do I cheer or do I just let her study? So, what were you about to ask Keaton? Sorry to interrupt.
Shoot. What was I gonna say? Oh, do you guys have? And so in PA school, is there a grading system or is it a pass-fail class based?
So your first didactic is what they call it. Your first year in the classroom from 8 to 5, you just sit in a classroom with like no walls or anything, and you just listen to lectures. They give you grades for your tests, and they give you a GPA that you have, and the top
Yeah.
of the class is the top of the class. Whoever makes 4.0, which is like crazy if you can make
Yeah.
a 4.0. But and then your clinical year, it's just pass or fail
Okay,
because
okay.
they're national exams. So at that
Oh,
point, you're just
yeah.
getting, passed.
Yeah.
So,
Yeah, that makes sense.
So a pass, is that 50% or is that 60,
70?
70?
I think a little bit over 70%. Just
Okay.
depends on the national average because
Okay,
it just
so it's-
varies
yeah.
for tests.
What do they do? So OU and OC are right next to each other. I
Mhm.
know that. So how do you split the training? Like, as the clinical, are your clinicals at OU Medical Center? Are you at St. Anthony's, or is it?
We aren't allowed, I guess, I don't know if allowed's the right word, to use OU medical facilities or
Yeah.
be associated with preceptors, which are
Yeah.
the ones who run our clinic rotations. So a lot of ours are kind of rural, thrown out in the middle of nowhere.
oh.
And
Ugh.
So you have to drive kind of far sometimes then.
yeah, I've been from north edge of Oklahoma, which I'm in right now, the south edge of Oklahoma. Some people have been all the way out in the far west, far east, everywhere.
Do you like
So-
the rural side, or are you gonna?
It has
Well,
its,
Stay.
you're from rural, so
Oh, I didn't know
Yeah.
that.
yeah, it's not bad.
Yeah.
It has its perks, but there's also
Do you see
sometimes.
yourself doing that, or do you see yourself staying in the city?
That's a good question. I still haven't figured it out yet.
Yeah.
you only have a year left, Hannah.
Less than a year.
Less than a year, sorry.
They both have their pros and cons.
Yeah.
Yeah.
The money wise is a lot different compared to metro versus rural.
Yeah. That makes
Because
sense.
they need providers out there, so they're gonna pay you extra money to be housed,
And
in the middle of nowhere.
Cost
So
of living is gonna be way cheaper out there, so it's probably
yeah,
nice. When it comes to like someone going into, like, if you were an undergrad, what would just starting out and you wanted to go to PA school, would you tell them to stick in biology, or would you say, oh, just go try some other major and then eventually you'll learn all this biology and stuff once you get into PA school?
honestly, biology helped out so much. Yeah.
Kind of a head
Makes
start
it
or
a
a jump
lot
start.
easier.
Okay.
The background, like the basis of the science that you needed for medical, I thought was like awesome, especially with Oklahoma Christian. Like I had a great foundation, and I think you need it because a lot of the students who were like sports wellness, or they did kinesiology or other stuff, they didn't have like the basis of a lot of the science that you needed for just medical, just general knowledge. So if you want to do an arts degree, go for it.
Yeah,
You just
it's
kind of
just-
have to make sure you get the biology and the
Yeah.
arts. But I mean, they like the diversity, like we were talking about
Yeah.
having you could have a theater degree or
Yeah, they want to
finance
Engineering.
or engineering.
interested in other things.
Dave was engineer.
He was, yeah.
Well, he double majored, but
Double majored.
What a
biology and
psycho.
engineering. That's like the dream for medical student.
yeah, what a
But
psycho. Dave's a
So
psycho.
going into PA school, I know for medical school you take the MCAT. Does PA school have a test that you take before? Or is it you take the GRE before?
What's the
PA school?
GRE? I'm not
Oh
familiar.
Oh
with
my
it.
gosh, I don't even know what it stands
I wonder
for.
if
That's
they
how
even use it.
what a
now.
joke it
'Cause
is.
there's been a huge movement in the last
But
2 years. To just
Graduate record examinations. It's a worthless test.
I should
honestly.
probably take
it's
it
like the ACT, but for
Oh yikes!
college students. That's another part. Like you cannot go into the test room with anything. Like not even barely with a shirt on your back. Like they just take everything away from you.
I don't know if my other students would like that.
To take the GRE, they literally don't let you have anything. But no, there's not a generalized test. OCU didn't make us have to have GRE.
Okay.
That wasn't something that was needed.
Yeah.
All the other programs have it, but they're like, oh, you took it, you know how to read. So
yeah, they don't care about the
No.
score. And I think I've noticed. So I'm applying to graduate schools right now. Almost all of them have gotten rid of the GRE requirement, and just in the past year.
yeah.
Because it's not related to science at all. It's reading and math, and that's it.
Yeah.
And it's not even real. It's
And you write a couple
like
essays.
a logic math. It's like 6th or 7th grade math. Or
Well, if
something.
they don't give you a calculator, I
No
hope so.
calculator.
I hope so.
You get well, it's hard.
Well, I mean, I'm a math guy, so maybe
engineer.
2 + 2 is 4. Yeah, I got it.
No, but it's not like that kind of math. I mean, I used to study for it a little bit because I thought I was gonna have to take it, and it's
So
hard to
it's
explain.
algebra
It's
problems?
logic problems.
Those algebra problems that your teacher flipped through the book and was like, you'll learn that later in life, and you never did in high school.
Oh, those are perfect. I love those.
Those are awful. Those are the evens in the back of the book, or the ones that you do even, but you only check the odds in the back of the book.
Oh, the ones without the
Oh,
solution.
good.
Yes.
Yeah,
We know Hannah always checked the back of the book.
I did.
Oh,
I
for
know.
sure.
I didn't check them for the answers. I knew I was right.
Sure. So
That's why I had a 3-1. Because I'm smart.
So now that you're about to graduate, you've been through several clinicals. We kind of talked about this earlier. You don't necessarily have a preference yet, but do you see yourself being in pediatrics or with adults?
I loved all of it.
You loved all of it.
So
So
well,
you-
what kind of options do you have? We'll go over the options and then.
So options. So PAs pretty much can work in any kind of setting, honestly, from clinic to office to hospital. Hospital's a newer setting that we're just kind of trying to get established in. But urgent cares, pretty much anything that you can think of. So family medicine clinic, urgent care, like I said, is kind of like a family medicine. ER is another one that's really good for PAs. Surgery.
So what really is different than being a doctor? Besides the school, I mean, obviously school's less, but job-wise, what's the difference? You just have PA instead of MD at the end?
MD or DO, they are, so they can own their own business, they can open their own clinic, and then PAs are actually licensed underneath the medical board that license MDs and DOs the same, but we're not allowed to own our own clinic. We're not allowed to ever be an employer of a physician. So we're underneath them. We practice, the way that they practice, but we also have an option to practice without them either being in the clinic or just kind of off-site. But they still check over our charts and make sure we're doing everything right. We're not doing anything illegal. Our malpractice insurance and everything is underneath them still. So we're just a stretch entity from them, but still practicing.
So in reality, you're going to school to own your own business, basically. You go to extra school to, I mean, I guess you have your own insurance. Yeah. It's not through somebody else.
It's kind of
Yeah,
if
it's
you wanna
another
be a
one.
surgeon, you want to be a doctor.
Yeah.
If you want to be in charge.
Yeah. PAs do the small little minor procedures of,
Because I've always thought PA was in between doctor and nurse was how I always thought of it. And I don't know if that's true, but.
Yeah.
It's a fair,
our
yeah.
title is mid-level. So, the doctor's the top is the top part that you can go to. They still are able to prescribe, all of the medications. There's different tiers for the medications, but PAs are only allowed to prescribe level 3 to 5, sometimes level 2 drugs. But that's a whole nother it's a whole nother entity in itself about the drugs that we can prescribe.
Well, okay. So, for example, a level 1 and level 2, is that over the counter?
So those are like the hard pain medication.
Oh, okay. So it's the opposite. Okay, the opposite of what I was saying.
It is. It's backwards.
Okay.
So level 1 and level 2 are like the ones that are so like cocaine and morphine and Percocet, all the fun ones, but they're all level 1, level 2.
Okay.
And so those are ones that PAs aren't allowed to prescribe.
Mm-hmm. And then so then what's the bottom level 5?
Yeah. Those
And
are
then-
like over.
Okay, your Advil or okay.
Those are the easy ones. So that's a huge difference for PA.
I'm glad we cleared that up because I
Does
was
that
gonna
make
go
sense
to I was gonna go to the pharmacist and say I need some level 1 drugs and
You might get arrested.
I'll get that Mucinex with the what Sudafed, yeah, Breaking Bad style.
Do you guys have like a pharmacology class, and did you have to memorize all those? That's not what that's not fun to me.
Yeah, we had a pharm class for every single like system. So like we'd go
Yeah.
through like the heart, cardio,
Yeah.
and go through like all of the medications for your heart. Yeah. And then like you would
Yeah.
pass that
Seems
test.
like a lot
Yeah,
of
and then
medications.
go for the lungs and get all the medications for the lung.
Well, I'm glad I didn't go to PA school because I had a tough time with memorizing the elements.
It's a lot of
So-
memorization. You know what I've been complaining about for the last year is the fact that there's not a PA PhD program. Like there's an MD PhD. Most MD PhDs don't end up practicing. They do research, but they have the clinical experience, which is awesome. Why don't they have a PA PhD? Like you have less time. No one wants to do the MD PhD because it takes forever, but you get the experience in the clinic, and then you can have a connection through research. That drives me nuts. I've been wanting that for forever.
They might. I know I've heard like some talk of trying to get it to be a 4-year
Yeah.
program. I don't know
Really?
about it being like connected to a PhD,
PhD.
but that would.
Oh,
I
they
mean,
wanna
like if
up-
you had the research, I mean,
Yeah.
the drive to do it,
Yeah.
then it might be a good.
Yeah. As of now, you'd have to do it like PA and then PhD, which it's too much. But that's my little rant right now.
So after PA school, you can go to do very many PAs go on to get their doctorate. I mean, that's what you were just
No,
asking.
no.
But like become an MD. I mean, that doesn't make sense, right? Because there's not really a next step after. Okay.
No, I mean, usually PA, whenever you graduate and you pass we have a test that certifies as, like, it's called the PANTS. Yeah, that's
get to
funny.
wear the pants. Yep.
Yeah. You pass that test and then you get certified through the medical board, and you can go practice and make sure you have your license and everything to write scripts, and then you have a job and
Make money.
Yeah.
The best part of graduating school.
Make PAs make good money. That's something I feel like a lot of people don't realize when they're, because a lot of people choosing in biology. They're like, oh, I don't want to go to medical school. Like, what do I do now? I'll switch to business or something. But if you have an interest in medicine, like PAs make a lot of money. It's a good stable job, and it's growing. I'm pretty sure.
Yeah.
Because
Less people are going to med school, so
It's
people don't wanna
expensive.
pay for med school.
Yeah.
It's ridiculous.
It's expensive. It's long.
they have a shortage of med students now. I mean,
they do.
And I'm sure you guys, like PAs, don't have to worry about medical malpractice near as much as doctors do. Like, I know that's just one of the biggest issues with. My dad complains about it all the time. Is doctors getting sued for just. I mean, things happen in medicine. It's not. You are not.
we're
Perfect.
human. We're human. First of all, we're human. I'll say it again. We're human,
Yeah, we make mistakes for
Yeah.
sure. But
and that sucks for you. Sucks for you in surgery.
Oh yeah. But yeah, I agree. It is a lot. Yeah, PA. I mean, I didn't even look up how much a PA makes before I even started school. I just kind of went for it. I was like, I don't really want to look it up. I'm just gonna do this.
Did you always want to do PA or?
I was my first decision was to do physical therapy, and then short story, just shadowed a physical therapist who looks like he did not enjoy what he was doing, and so I was like, oh, I'm gonna find something else, and so shadowed a PA, loved it, and then just from then on, set to apply and get in. And
You think
Here I
you're
am.
gonna do ortho?
Oh, ortho is a special place in my heart. I worked in it for
Yeah.
8 months before PA school.
Ortho as in orthopedics?
Mhm.
Wow, I'm so smart.
Yeah. I like it.
And that's where all the athletes end
Yeah.
up. So it's like
yeah,
you're destined to go there.
Yeah.
So.
yeah. The sports aspect is
Yeah.
still there, but
Yep.
it's up there.
Yeah.
Still don't know yet.
Yeah. And I think we talked about it a little bit earlier, but PAs, when it comes to surgery, how do they help, or like what do they do?
So a lot of the times it's like you're just like an extra. So if like a surgeon only has 2 hands and they like really just want a third one,
Yeah.
you're that third hand
Yeah.
that you're able to, hold stuff, do stuff, suture.
Yeah.
Certain steps and procedures during the surgery you're allowed to perform.
Yeah.
Which is I saw that. It was really cool, but you're an extension of the surgeon.
Yep.
Then you do like in clinic stuff, post-op.
Yeah.
When they come back in after surgery, take a look at
The
them.
important stuff.
Yeah, do med refills, see the patient before surgery. So it's a whole nother world for surgery for
Yeah.
sure.
Yeah. Not your.
Not my cup of tea.
Yeah.
No.
So, if somebody was going to go into PA school, what would you recommend to them? They're going to be a freshman in college. What would you recommend?
That's
You
a
might not
big
have any
one.
recommendations.
Honestly,
Trial by fire.
yeah, honestly, if like you love the medical field, or if that's something that you're passionate about, I mean, definitely weigh your options, especially as a freshman. Like, look into what are the different things, like what route do you want to go to? Do you want to be in charge 100%? MD. You want to do, kind of mid-level stuff like a PA, you're still getting to practice, you're still getting to do medications, but you don't have that much of a responsibility for, like we said, insurance and all that stuff, but you still have somebody to fall back on, which is your attending or your physician that you're under. PA is perfect for it. You want to do nurse? Nurse is a whole nother different route. You just have to, I think,
There's 3 tiers.
Yeah.
The 3 tiers:
3
doctor,
tiers of
PA,
the medical system.
It
nurse.
really is.
and then
But
researcher.
the real,
Sorry, Keaton.
the real top tier is administration.
Yeah. Mhm.
That's the worst part about the medical system right
Yeah.
now.
Yeah, but I mean, I think I would just say weigh your options, and if you pick one that you like, then go for it. But then from then on, just jump into it full force.
And you would recommend shadowing somebody,
Oh, yeah.
finding somebody?
Oh yeah,
And-
shadow all, like shadow MD, DO, PA.
But thank you so much for stopping by, Hannah.
Yes.
It's been an honor. I learned actually quite a bit. I don't know why I was surprised, but I learned quite a bit. And thanks for stopping by. Thank you guys for watching. We'll see you next week probably. We're gonna have Dylan on. Dylan Needham, the Viking MMA.
Oh.
So that'll come out. We'll see. He hasn't recorded yet. So,
Yeah.
but thanks for stopping in, guys. And this has been Simply Technical.